Thanks for the opportunity to talk about a little bit of my research here. Actually, I joined the IU is about this January. Before I came here, I worked in West Virginia University. My research is focused on lifestyle and the environmental factor, how they related to cancer risk and cancer prognosis. So here just a couple example, my previous work during the last few years. So I worked look at how smoking related to breast cancer. So our study found that smoking does increase risk of breast cancer, the active smoking. And also in the study we found that it's like a passive smoking also increase risk of getting breast cancer. So another study I involved is look at the toxical release inventory discharge, how they relate to lung cancer. This is kind of EPA, environmental, they have those toxical release inventory data. So we used this data and look at those pollutants and how they relate to lung cancer. So we did find the association between release a lot of carcinogen to the environmental, so the increased risk of getting lung cancer and also increased risk of dying from lung cancer. Sorry. Currently, I'm more interested in diabetes, how they related to cancer risk and cancer prognosis as well. And as we know, the prevalence of diabetes in our population is very high. So my interest is want to look at how the diabetes is related to different type of cancer risk. So what I look at is including gastrointestinal cancers and also lung cancer and all those major cancers, breast cancer, colorectal cancer. So some of the study I already finished. For example, we do find that diabetes increased risk of liver cancer, pancreatic cancer, colorectal cancer, and lung cancer as well. Especially for lung cancer, especially the treated diabetes, the patient who need receive the insulin, so increased risk of lung cancer. And recently, I also some of the study I'm still is ongoing. So and also I want to look at how the diabetes or treatment of diabetes, for example, different drug like metformin, insulin, different type of treatment for diabetes, how they related to cancer prognosis. So I'm going to look at for breast cancer and colorectal cancer. And luckily, I just got NIH funding to do this diabetes and diabetes treatment, how they related to breast cancer. And also, there's another study is internal funded is how diabetes and diabetes treatment related to colorectal cancer. So which is I'm doing right now. And this is said, my main interest is look at the lifestyle and the environmental risk factor, how they relate to cancer. So at this moment, I'm also planning another study. Is called bisphenol A, how they related to cancer, because the a human exposed to BPA, we call BPA, is kind of a draw really a great attention because it's very widespread of the BPA, to the humans. And also some study already find that BPA have some androgen disrupting effect. So we do have a lot of animal study and support this hypothesis, but so far only one human study in Korea. They didn't, because it's case control study, they didn't find the relationship of BPA and breast cancer. So I'm planning, our team planning to do and see, because it's really a human concern, like a health concern. So we want to look at the BPA, whether increased risk of breast cancer or not. Thank you.